Welcome to Perlman Quadrangle and Irvine Auditorium. Irvine Auditorium is a non-smoking facility. Restrooms are located on the lower and second balcony levels. Vending machines and payphones are located only on the lower level. Assisted listening devices are available upon request. Please take time to note the exit clearly marked at the front and rear of the auditorium. If for some reason there is an emergency, please use these exits to vacate the building in an orderly fashion. For your safety and the safety of others, after exiting, please move away from the building as far as possible. Please take the time now to silence all cell phones or beepers for thorough enjoyment of today's presentation by yourself and others.
Welcome, and please feel free to sit down if you're standing. Welcome, family, friends, distinguished faculty, and most of all, the graduating DScD and master's students. Today is an important milestone in your academic and professional journey, and your contributions to the school are being recognized. You have pursued knowledge through scientific inquiry, which has advanced dentistry and enhanced the reputation of our school. Unlike a trade, a profession like dentistry is defined by knowledge. Your work strengthens our profession and will shape clinical practice and policy. Your degrees come with responsibility. Responsibility to your patients, to your community, and a commitment to always be involved in acquiring new knowledge. Congratulations on your many and substantial achievements. I hope that your time at Penn Dental Medicine has left you with a sense of pride and long-standing fulfillment. I welcome you as members of the Penn Dental Medicine family, congratulate you, hope that you are always successful and that you come back often. Congratulations. Dean Wolff.
So I'm honored to be here, and it's even a greater chance for me to welcome the families, friends of our graduates. This is an absolutely wonderful occasion. I'd like to welcome our faculty and staff who are here. So many have contributed to the education that's so important. It's fantastic that in addition to not only our physical presence, but we actually have a broadcast presence for those who could not be here in attendance, and they will get to see the full event along with you. We are live streaming. We're delighted to have you join us today. It's an incredible occasion where today we are able to graduate 5 students with Doctors of Science in Dentistry, 9 Master of Science in Oral Biology, 6 Master of Oral Health Sciences, and 2 with Master of Oral Population Health degrees. This is an outstanding statement about you, and it's an outstanding statement about your university. You're graduating as accomplished scholars and clinicians, people of science, skilled in the healing arts, and for that we congratulate you. Graduating classes of students at universities all over the United States today and around the world are hearing some troubling comments, if at minimum. They're hearing that the job market is changing and that their futures may be called into question by new technologies, artificial intelligence. Will first-year lawyers actually be able to find jobs writing briefs and contracts, or will AI be able to replace them? It's a very interesting question, and before family members and graduates become depressed, I will say that this story has a different ending. I don't believe that you are subject to that same pressure. It's not that we won't use AI, we will, but you need to learn how. I'm going to tell you a story 20 years ago. It seems so long ago. I need to set this up. I was asked to give a keynote address at a major electronic health records conference talking about the new technology. But we have to put it in context. It's unimaginable. 20 years ago, When I stood up to speak, Apple CEO Steve Jobs had not yet stepped out on a stage and announced the first smartphone. We were still using BlackBerries. What did he call it? An iPhone. It revolutionized how we think, how we talk, and what we do. The iPhone was back in ancient times. It came out in 2007. But when I gave my presentation 20 years ago in 2006, Google was less than 8 years old. You know, it's funny, just last week, its major competitor Ask Jeeves. Anybody actually ever heard of it? They went out of business. Yahoo was a web browser similar to Google before Google crushed it. Can you imagine a world without Google? I spoke about the power of information, including health information that would be democratized. Everybody would be able to get information, including our patients. This newly available medium was called the Internet. It was less than 20 years old at that time. Health professionals were frightened, literally having conversations that their patients would self-diagnose, even self-treat. Even more frightening to a health professional, the patient might actually question what we were recommending and say, "I read, what about?" Wow, we would have to justify our treatment recommendations, and that is not something healthcare professionals were actually being trained to do. How dare a patient actually question what their doctor recommended for them? What if they couldn't understand the information? What if the internet was wrong? I really had patients come into my office, pull down their lips, say, "You see, it's bleeding down here. I think I have cancer." When the real answer was, "We really should clean your teeth more than once every 5 or 6 years. You have chronic inflammation that needs to be managed." But that was actually only the beginning. Social media took off, the smartphone, the access to the information, but worse than that, misinformation, disinformation. It got worse. And today, the world you're entering is a world of information, some of it good and some of it bad. You chose to come to Penn Dental Medicine before all of this confusion actually had started. This is our last 5 or 6 years that we question health the way we do. Before 2020, the calm days, vaccines had a schedule, and people actually did it. Can you imagine a world where polio was coming back? Where a healthcare provider says, "You need the following vaccines," and because we believe in self-determination, a patient actually looks and says, "Not so much. I don't think we'll try that now. We'll take it maybe a little bit later." It puts you, puts your children, puts your grandchildren, puts all of us at risk. How are we going to work in that environment and change how people think going forward? You chose to come to Penn Dental Medicine because of our innovative programs, because of our legendary reputation for innovation, the human health and its ability to elevate the profession to new heights. Penn Dental Medicine is a historic institution and one of 12 schools within a university that was started by America's founding father, Benjamin Franklin. The University of Pennsylvania opened in 1751 with Benjamin Franklin serving as its first president. Is my hair right? Because I had that cap on, it ruins the hair. The university has a long-standing legacy of advancing society and science. The School of Dental Medicine was established in 1878. Notable graduates of our school, first graduating class, W.D. Miller, defined how tooth decay occurred. It wasn't bacteria chomping on the side of the teeth. Rather, it was bacteria eating carbohydrates, fermentable carbohydrates, and pooping acids. And the acids dissolved the tooth. That was pretty incredible. Matthew Cryer, an oral surgeon, was the first person to put oral surgery into hospitals and make it a hospital-based specialty. In 1901, Lester Burkett defined the discipline of oral medicine, and his textbook has been used by every dental graduate in every school in the United States. It's become the standard by which all people learn and function. He served as dean here from 1951 to 1972. Periodontal care, the saving of teeth, as a current day standard was defined by D. Walter Cohen and Morton Amsterdam in the 1960s, 70s, and 80s. Dean Marjorie Jeffcoat helped define the dental systemic disease link. Today's faculty are defining modern ceramic dentistry, CAD/CAM dentistry, computer-assisted design and manufacture, care for persons with disabilities, cancer care, inflammatory mechanisms and processes, nanotechnology in dentistry, creating new vaccines for herpes, plant-based chewing gums to kill COVID and flu. The list is exhaustive. These were the people that educated you. These are the people that sit here right now. Penn Dental Medicine celebrated 70 years of public water fluoridation in Philadelphia. We didn't invent fluoride, it was in the environment. But in 1901, Penn Dental Medicine graduate, Dr. Frederick McKay, was keen enough in his investigations to recognize the effects of fluoride. You are joining a long legacy here at Penn Dental Medicine. Doctors and scientists dedicated to greatness. Our central building was made possible by the donation of Dr. Thomas Evans in 1897. I invite all of the families to please come visit Penn Dental Medicine today. Look at this place. It's really quite amazing. It is the most modern of facilities, though built over 100 years ago. Upon his death, Dr. Evans charged Penn Dental Medicine to become a school second to none, and that it has become a school second to none, secondary to the students that join us, the faculty that work there every day, and the things that we get to do. We hope your experiences at Penn Dental Medicine inspire you to make lifelong commitment to using your skills and your knowledge, to balancing some of the inequities in society. So back to the question of artificial intelligence and being replaced. None of us know what the future holds for us, but our lives and the world will change significantly. How we answer phones, schedule patients, manage inventory, even develop treatment plans may all be changed by artificial intelligence. The way we conduct research, which is the most likely to give us the changes we're looking for, AI will advise us. But only if we understand the science. AI will not be able to replace your job if you realize it's the human that we're involving, if you understand the items that are important to making decisions, if you have studied what it means to make an evidence-informed decision, choose evidence-informed materials, do evidence-informed science, not propagate misinformation. You experience so much more than those that came before you, and you experience the human connection, the ability to help those with fear communicate with the vulnerable, provide relief for those others ignore. Look for solutions for perplexing health problems that nobody was able to find before. It's the human connection, and that's something that AI can never replace. The empathy, the gentle touch, the simple eye contact between humans, that's all part of what will define you and your career going forward. You join a historic alumni who demonstrated insight, innovation, faith in science, impacting generations of patients and individuals. As an alumnus, it's your mandate to uphold and honor the integrity of science amidst a societal wave that's pushing for changes. What was the greatest societal ill that came out of the COVID pandemic? I would conjecture to you that it was a loss of faith of science of many of the people that surround us. The rise of alternative science, not questioning science. Science always questions the answer. And the things that were written today may not be correct tomorrow, and that's what best evidence is. But the inability for us to question science, the adoption of an ideology that may not be founded in science, is sure to destroy a society. In a society where measles and polio are on the rise, we need scientists and health professionals committed to empathetically helping the public navigate the truth. Utilize your curiosity, your intellect, your passion to serve those in need, to help change the world. As consumers of science, go out and help the public sort through the myriad of disinformation and intentional misinformation that's being thrown at them. Become the educators, the inventors, but also become the community leaders and voices to help build a greater society. At Penn Dental Medicine, you partnered with your faculties from other schools to find solutions to the world's most perplexing issues. You're fated for greatness. In the communities in which you will live and practice, you must step up and help the community grow. We are counting on you to do great things and lead as generations of Penn graduates before you have. I thank all of our faculty who work so hard to make this possible for you. We celebrate your advanced degrees, and you are now part of the solution. Our community faces challenges. You play a crucial role in inspiring future generations of Penn Dental Medicine students. Thank you.
Thank you, Dean Wolff. Okay. So now we will begin the hooting ceremony and the distribution of the diplomas. And we will start with hooting of DScD graduates first. To hoot the students, each of the mentors will come up. Once you get hooted, please, you will be getting a professional photo at the end with Dean Wolff. We welcome to the stage the following who will hoot the DScD graduates: Dr. Dana Graves, Vice Dean for Scholarship and Research; Dr. Marco Tizzano, Associate Professor, Department of Basic and Translational Sciences; Dr. Shuang Yang, Professor, Department of Basic and Translational Sciences.
Dr. Bushra Halaf Hamdan El-Hamdi. Dr. Shahat Muhammad El-Maswari. Dr. Lina Baisa. Dr. Abdulaziz Hakim.
Okay.
Dr. Afnan Khalifa.
This person. Okay, congratulations. So now we will welcome to the stage the following, who will hood the master. Oh, sorry. Yeah, we'll wait. Yeah. Perfect. So please join us at the stage, Dr. Esra Shahinger, Associate Dean of Graduate Studies and Student Research, Dr. Kathleen Battaglia, Assistant Dean for Academic Initiatives. You're here, okay. Dr. Yu Chen Cheng, Assistant Dean for Emerging Technology and Patient Care. Dr. Gil Suwan, Associate Professor, Division of Restorative Dentistry. Dr. Taiwan Kim, Instructor, Department of Periodontics. Dr. Chan-Chuan Lee, Associate Professor of Orthodontics. Dr. Nupur Patel, Division Chief of Division of Prosthodontics. Dr. Flavia Tellis, Professor, Department of Basic and Translational Sciences. Dr. Kyle Wining, Associate Professor of Preventive and Restorative Sciences. And Dr. Lauren Yep, Clinical Assistant Professor, Division of Pediatric Dentistry.
Nahil Al-Qadiri. Mohammed El-Shamali. Inwon Chan. Jan Chan. Rebecca Choi. Andrew Greensell. Selena Gould. Amy Samantha Lin. Dina Azam Mesmar. Ahmet Alkalam. Bing Chan. Dr. Ruri Das. Zari Guan. Madison Linnea Orr. Karina Sofia Solano Vargas. Dr. Azin Pur Ismail. Dr. Androniki Andrea Redeos.
Okay, Congratulations to all our graduates. Please join me for another round of applause. Congratulations. And we invite everyone for a reception back at School PDM starting at 5 p.m. To all our guests, please allow our graduate doctors to process out. And please join us on the plaza to take a lot of pictures. Thank you.